Hi, my name is Dr. Johnson. I'd like to take this opportunity to introduce you to the technologies we routinely use during the course of the examination. Feel free to look at these videos. It'll give you some ideas to what to expect during the course of your routine exam. This technology is a computerized autorefractor. What it can do is give us an objective measurement of the patient's prescription. We then compare this measurement with a subjective measurement that we take in the regular examination room. Gives us a good starting point. This is a new technology we've recently added to our office. It measures the blood supply to the back of the eye. We now know that a decrease in blood supply to the back of the eye can be responsible for vision loss. With this technology, we actually measure the blood supply to the back of the eye, giving us more information as to what might contribute to future problems concerning vision loss. This is also newer technology, originally developed for hospital use to look at the retina on a baby. It was designed to evaluate shaken baby syndrome, where there's actual damage to the back of the eye secondary to trauma. What we're doing now is simply taking this camera, this handheld camera, and holding it close to the area of the eye that we want to monitor. It's easy on the patient, it's fast, and it's just very productive as far as establishing a permanent record. We use this to measure the anterior part of the eye, the front part of the eye, with our glaucoma screenings. We also use it to monitor any type of pathology on the front of the eye that we want to follow over time. It's turned out to be really a nice addition to our technology. This technology allows us to check the pressure inside the eye. It's called a non-contact tonometer. And we can measure the pressure simply with a slight puff of air. The value of this, if the pressure is too high inside the eye, it can indicate a condition called glaucoma. And that is a sight-robbing condition, kind of like a thief in the dark. You don't know it's there until it's too late. So this is an important aspect of our pre-testing on a routine examination. This technology is new to the office. It's actually new to the industry. It's called optical coherent tomography, or OCT. This allows us to look underneath the retina, like a CT scan, used in other parts of the body in delivering healthcare. So actually we're getting a CT scan, which is a cross-section of the retina. So we're looking beneath the surface of the retina. It allows us to pick up any disease or degeneration of that retinal tissue before we can see it conventionally with other technologies, or even before the patient is aware of any problems. This technology is a much more sophisticated optical coherent tomographer. We use this to monitor, detect conditions such as glaucoma, macular degeneration, or freckles, or moles on the retina. And with this technology, we can very accurately monitor change over time. As with the other OCT that we use, it will definitely evaluate all the 10 layers of the retina. So we pick up any pathology, we can tell what part of the retina is involved, and early treatment always best in any type of healthcare, and especially involving sight. So we can pick up sight-threatening problems more frequently than we could with other conventional means of looking at the back of the eye. These are different types of diseases or degenerations represented by the cross-section of the CT scan, and by looking at the location or the type, we can determine what treatment path would be necessary in order to help that patient. Another technology that we use the OCT for is to evaluate the integrity of corneal tissue. We can actually use this instrument to do what's called an anterior OCT, or cross-section of the cornea. It gives us more information about corneal health. That's what these little Medusa type deal things here we can position these as targets for the patient to look at as we're doing our cross sections. The OptoMap is a technology we've been using for a number of years that allows us to capture an image of the surface of the retina. We can evaluate the optic nerve and the blood vessels of the retinal surface. Also, looking at the retinal surface, we can determine if there is any disease or degeneration taking place. It's a wonderful technology, and our patients love it. This is what we see when we look inside the eye. With this technology, we now have an opportunity to show the patient what we're seeing. We can show them the optic nerve and the blood vessels and retinal tissue. Now we have a permanent record that we can compare over time. This is another new technology we've added to our office. It's called preferential hyperperimetry. We use this technology to monitor changes in vision for our patients who have macular degeneration or other macular problems. With this technology, we can pick up changes before the patient is even aware of any vision loss. This technology is a computerized topographer. It measures really the contours, the peaks and the valleys of the surface of the cornea. We use this routinely for any contact lens fitting as well as any of our LASIK patients. So when we screen for LASIK, what is important is the topography of the cornea, anatomy of the cornea. And this gives us information that we need in order to pursue that, as well as contact lens fittings. Hi, this technology we're using here and illustrating measures peripheral vision. And when she looks in this instrument, what she's seeing are little stimuli, visual stimuli, in the different areas in the periphery. This allows us to see if there's any defect in the peripheral vision. Oftentimes we can pick up disease or degeneration much sooner than the patient's even aware of it. The nice thing about this computer technology that we have in our offices is that we can show the patient, while they're sitting in the examination room, the results of all these tests. I can show them what we see when we look inside the eye, where in the past we couldn't do that. I can show them the cross-section of the retina. I can explain what that cross-section means. We can look at the back of the eye. We can look at the optic nerve. We can look at the blood vessels. And for the first time, the patient has an opportunity to see what we see when we look inside the eye. Really allows us to deliver better care and inform the patient as to what exactly is going on and what prognosis or any treatment program that would be indicated.